Assalamualaikum. I am Dr. Nilufa Yasmeen, lecturer at Biochemistry Department of Bashundhara Ad-din Medical College in South Keraniganj, Dhaka. Today I am going to discuss the topics about liver function test. Liver function test. Specific learning objectives. Enumerate various major functions of liver. Classify liver function test based on laboratory findings and clinical aspects. Major liver function. Synthetic function. Plasma protein except immunoglobulin, clotting factors, complement factors, primary bile acid, hepatoglobulin and ceruloplasmin, transferrin and metabolic function. Liver is the central organ of metabolism of carbohydrate, protein and lipid. Through the glucostatic function, liver actively participates in regulation of blood glucose concentration. Then secretory function. Liver secretes bile into the intestine. Excretory function. Through biliary tract and fecal route, liver excretes bile pigment, bile salt, drugs and cholesterol. Storage function. Glycogen, fat soluble vitamin, vitamin B12. Biotransformation. Detoxification function. Purpose of detoxification, it makes water insoluble toxic substance into water soluble non-toxic to facilitate their excretion through urinary and fecal route. Now liver function test. Liver function tests are chain of blood tests done to evaluate and monitor the treatment of hepatic dysfunction. Indication of liver function test. Differential diagnosis of jaundice and diagnosis of liver disease. Assessment of severity of liver disease. Assessment of prognosis of liver disease. Treatment monitoring and detection of complication. Category of liver function test with their importance. Test for hepatocellular damage. It is done by measurement of serum, alanine transaminase, aspartate transaminase, gamma glutamyl transferase raised in hepatocellular damage. Then test for cholestasis done by measurement of serum, alkaline phosphatase, gamma glutamyl transferase 5-nucleotidase raised in cholestasis. Test for synthetic function, it is done by measurement of serum total protein concentration, normal range 6 to 8 gram per deciliter, serum albumin concentration, normal range 3 to 4 gram per deciliter and serum albumin to globulin ratio normal 2:1 and prothrombin time normal range 12 to 14 seconds. Synthesis of albumin exclusively happens in liver, but globulin are partially synthesized in plasma cells as well. In hepatic dysfunction, serum concentration of total protein and albumin decrease markedly, but serum globulin concentration is little affected, so albumin to globulin ratio is decreased or even reserved in hepatic dysfunction. Test for excretory and conjugating function. It is done by the measurement of serum bilirubin concentration, total, direct and indirect. Bilirubin is produced in reticuloendothelial cells and transported in blood along with albumin. Test for metabolic function of liver. It is done by galactose tolerance test. Galactose after absorption goes to liver and mostly converted to glucose with little amount of galactose excreted in urine in hepatic dysfunction. A test does of galactose given orally more than expected amount of appears in urine. Limited of liver function tests, about 75 to 80% needs to be out of function for any of the liver function tests to be positive. Due to numerous functional reserves, capacity and marvelous regeneration power of the liver, only a small portion of liver enough to perform all the functions. Thank you.